Welcome back. The CDC says cases of walking pneumonia in kids are on the rise.
In this week's Health Smart Report, Fox 43's Amy Lutz talked to UPMC Children's Hospital in Harrisburg, who says that they are seeing this firsthand.
It's that time of year when kids come down with all sorts of illnesses. This year, though, there's growing concern over a rise in Mycoplasma pneumonia, a bacteria known to cause walking pneumonia.
And is what we consider more of an atypical bacteria. So it's not one of the usual bacteria that causes pneumonia.
Dr. Glenn Kluka with UPMC Children's Hospital Harrisburg says it's called walking pneumonia because most people walk around for a week with just mild symptoms before it gets worse, which in turn helps it spread easily. Anyone can get it, but they're currently seeing it more in younger kids.
We do see a lot of children with it. We've admitted a large number of children, much more than normal with this.
Dr. Kluka says the increase in cases has caused him to adjust their treatment measures to match, saying even typical antibiotics that normally work for pneumonia don't for this strain. Monitoring your child's health can help. Symptoms of walking pneumonia include a dry cough, fever, sore throat, and fatigue, which Dr. Kluka says can last for weeks. Early detection and treatment can prevent severe complications.
Keep a close eye on their children and how they're breathing to see if they need further treatment.
And as always, keep up with regular hand washing and wear a mask to help prevent the spread if you do get sick. So the question is, why are these cases spiking? Well, there isn't one clear reason why, but Mycoplasma pneumonia rates do tend to spike every 3 to 7 years as people lose their immunity to the virus. With your Health Smart Report, Amy Lutz, Fox 43 News.